Have you been feeling more tired than usual lately? Or noticed your skin looking paler? Maybe you've been experiencing unusual cravings for ice, or your nails don't look quite right. These could be important signs your body is trying to tell you something. Iron deficiency is one of the most common nutritional concerns worldwide, especially for people over 50. After age 50, our bodies can have a harder time absorbing nutrients, and certain health conditions become more common. Many people live with low iron for months without realizing what's causing their symptoms. They might think they're just getting older, or that feeling tired is simply normal at this stage of life. But your body gives you clear signals when iron levels are dropping. These signals can show up in your skin, your nails, your tongue, and even in unusual cravings. Stay with me because I'm going to share 9 important signs of iron deficiency that you can recognize yourself. Before we begin, please subscribe to the channel and turn on notifications. Leave a comment letting us know which part of the world you're watching from. Let me explain what iron does in your body. Think of iron as the delivery truck that carries oxygen throughout your body. Iron is part of hemoglobin, the protein inside your red blood cells. When you breathe in, your red blood cells pick up oxygen and deliver it to every cell, from your brain to your toes. Without enough iron, your body can't make enough hemoglobin, which means your cells don't get the oxygen they need. This is why fatigue is often the first symptom people notice. Studies show that iron deficiency affects about 10 to 15% of people over 60, with women at higher risk. The good news is that once identified, it can usually be treated effectively. Sign number 1, paleness in your skin and inside your lower eyelids. When you don't have enough iron, your body can't make enough hemoglobin, and hemoglobin gives blood its red color. With less hemoglobin, your blood becomes lighter, making your skin look paler. Gently pull down your lower eyelid and look at the inner part. In someone with healthy iron levels, this area should look pink or red. If you have iron deficiency, it will look much paler, almost white. You can also check the palms of your hands. The creases should be noticeably red or pink. If they look the same color as the rest of your palm, this could indicate low iron. Press down on a fingernail, then release it. The nail bed should quickly turn pink again. If it stays pale, this might suggest iron deficiency. Paleness develops gradually, so sometimes family members notice it before you do. Sign number 2, extreme fatigue and weakness that doesn't improve with rest. This is the most common symptom, but people often dismiss it as just part of getting older. The fatigue from iron deficiency feels different from regular tiredness. It's a deep, overwhelming exhaustion that makes even simple tasks feel difficult. You might need to sit down after walking upstairs, or feel like you need a nap even though you slept well. This happens because your muscles and organs aren't getting enough oxygen to produce energy efficiently. Many people describe it as feeling like they're moving through thick mud. What's important to understand is that this fatigue doesn't improve much with rest. You might sleep 8 or 9 hours and still wake up feeling tired. If you've been experiencing persistent fatigue for more than a few weeks, talk to your doctor about checking your iron levels. Sign number 3, shortness of breath during normal activities. When your blood can't carry oxygen efficiently, your body compensates by making you breathe faster. You might feel short of breath after walking to the mailbox or climbing stairs. Your breathing rate increases and your heart beats faster to pump more blood through your system. This can make you feel anxious, especially if you don't understand why it's happening. It's important to note that shortness of breath can also indicate heart or lung problems, so this symptom should always be evaluated by a doctor. But if it's accompanied by other signs of iron deficiency, low iron levels might be contributing. Sign number 4, spoon-shaped fingernails, also called koilonychia. This unusual sign occurs in more severe cases. Normally, your fingernails have a gentle curve. With koilonychia, the nails become thin and brittle, and the center dips inward, creating a concave shape like a small spoon. The edges might curve up, and sometimes the depression is deep enough to hold a drop of water. This happens because iron is essential for making keratin, the protein that gives nails their strength. Koilonychia usually develops slowly over months and most commonly affects the thumbnails first. The good news is this condition is reversible. Once iron levels are corrected, New nail growth will be normal, though it takes several months to grow out completely. Sign number 5. Intense cravings for ice or other non-food items, a condition called pica. This is one of the most interesting and specific symptoms of iron deficiency. Pica is the medical term for craving and eating things that aren't food. In iron deficiency, the most common form is craving ice. People with this symptom feel an overwhelming urge to chew ice constantly throughout the day. We're not talking about enjoying a cold drink on a hot day. These are intense, persistent cravings where people might consume multiple trays of ice every single day. Some people keep ice with them at all times and feel uncomfortable when they don't have access to it. Other forms of pica related to iron deficiency include craving clay, dirt, chalk, or starch. While this might sound strange, it's actually a recognized symptom that affects a significant number of people with iron deficiency. Scientists aren't completely sure why these cravings develop. One theory is that the body somehow knows it needs nutrients and triggers these unusual appetites, even though the substances craved don't actually contain iron. What's remarkable is that these cravings often disappear within days to weeks of starting iron supplementation, even before iron levels have fully normalized. Sign number 6. A smooth, sore tongue that looks unusually shiny. This condition is called atrophic glossitis, and it's a specific sign of iron deficiency that can be quite uncomfortable. Normally, your tongue has a slightly rough texture because it's covered with tiny bumps called papillae. These papillae contain your taste buds and give the tongue its normal pink textured appearance. In iron deficiency, these papillae can disappear, making the tongue look unnaturally smooth, shiny, and often pale or bright red. The tongue might feel swollen, sore, or burning. Some people describe a feeling like they've burned their tongue, even though they haven't eaten anything hot. This can make eating certain foods uncomfortable, particularly spicy, acidic, or rough-textured foods. The loss of papillae can also affect your sense of taste, making foods seem bland or different than they used to. You can check for this by looking at your tongue in a mirror. A healthy tongue should have a slightly rough surface with visible small bumps. An iron-deficient tongue will look unusually smooth and shiny. Sign number 7. Cracks or sores at the corners of your mouth, called angular cheilitis. These are small splits or cracks that develop where the upper and lower lips meet at the corners of your mouth. They can appear on one or both sides and can be quite painful, especially when you open your mouth to eat, talk, or yawn. The cracks might look red, swollen, and crusty, and they can sometimes bleed or develop a scab that keeps breaking open. Angular cheilitis related to iron deficiency happens because low iron affects the health of your skin and mucous membranes. Without adequate iron, the tissues at the corners of your mouth become more fragile and susceptible to breaking down. Many people with this symptom find that the cracks keep coming back, even when they try to treat them with lip balm or ointments. This is because the underlying iron deficiency needs to be addressed for the problem to fully heal. Once iron deficiency is treated, angular cheilitis usually heals within a few weeks. Sign number 8. Red or pink urine after eating beets, a phenomenon called dietary. This is a fascinating indicator that can suggest iron deficiency. Most people can eat beets without their urine changing color because their digestive system breaks down the red pigment in beets before it reaches the kidneys. However, in people with iron deficiency, this pigment isn't broken down as efficiently, so it passes through the digestive system and into the urine, turning it red or pink. Studies have found that only about 10% of people with normal iron levels experience bituria, but up to 80% of people with iron deficiency will notice their urine turning red or pink after eating beets. The color change usually appears within a few hours of eating beets. It's important to note that red urine can also be caused by blood in the urine, which needs medical attention. The key difference is that bituria only happens after you've eaten beets or foods containing beet juice. Sign number 9. Restless leg syndrome. An uncomfortable sensation that makes you feel like you need to move your legs constantly. This condition is particularly troublesome because it often gets worse in the evening and at night, making it difficult to fall asleep or stay asleep. People with restless leg syndrome describe feelings of crawling, tingling, aching, or electric sensations deep inside their legs, usually in the calves. The sensations create an irresistible urge to move the legs, and moving them provides temporary relief. When you're sitting still or lying down trying to rest, the uncomfortable feelings intensify. The link between iron deficiency and restless leg syndrome is quite strong. Research has found that many people with restless leg syndrome have low iron levels in their brain. Even when blood tests show normal iron in the rest of the body, iron is essential for producing dopamine, a chemical messenger in the brain that helps control movement. Studies have shown that up to 60% of people with restless leg syndrome improve significantly when they correct their iron deficiency through supplementation. The improvement might take several weeks or months of iron supplementation before symptoms start to get better. Now let me explain how to get properly tested and treated. Schedule an appointment with your healthcare provider and describe your symptoms in detail. The primary blood test is called a ferritin test, which measures your iron reserves. Normal levels are generally between 30 and 300 nanograms per milliliter. However, ferritin can be elevated by inflammation or infection, even when iron stores are low. If your ferritin seems normal but you have symptoms, your doctor might order a complete iron panel with additional tests for a clearer picture. If iron deficiency is confirmed, treatment usually starts with oral iron supplements like ferrous sulfate, ferrous gluconate, or ferrous fumarate. Take these once or twice daily on an empty stomach for best absorption. In severe cases, your doctor might recommend intravenous iron infusions. Equally important is identifying why you became iron deficient. The main causes fall into three categories. First is increased demand, like during pregnancy. Second is decreased intake or absorption from diet issues, vegetarian or vegan diets, where plant iron absorbs 2 to 3 times less efficiently, or digestive conditions like celiac disease. Certain medications like proton pump inhibitors can also reduce absorption. The third category is blood loss, the most common cause in adults. For women before menopause, heavy periods are frequent culprits. For people over 50, digestive tract bleeding from ulcers, polyps, hemorrhoids, or colon cancer is a significant concern. This blood loss is often hidden, which is why doctors recommend screening tests like colonoscopy if you're diagnosed with iron deficiency. There are several practical steps you can take to support healthy iron levels through your diet and lifestyle. If you eat meat, include iron-rich animal sources like beef, chicken, turkey, and fish in your diet several times a week. Red meat, particularly beef and lamb, contains the highest amounts of easily absorbed iron. Animal sources of iron, called heme iron, are absorbed much more efficiently than plant sources, typically at a rate of 15 to 35% absorption compared to only 2 to 20% from plant sources. If you follow a vegetarian or vegan diet, focus on plant sources of iron such as beans, lentils, chickpeas, tofu, quinoa, fortified breakfast cereals, and dark leafy greens like spinach, kale, and Swiss chard. Dried fruits like apricots, raisins, and prunes also contain iron. The iron from these plant sources, called non-heme iron, is not absorbed as easily, but you can significantly improve absorption by consuming vitamin C at the same meal. The vitamin C helps convert the iron into a form that your body can absorb more easily. Add orange slices, tomatoes, bell peppers, strawberries, broccoli, or a glass of orange juice when you eat iron-rich plant foods. Even adding lemon juice to your water during meals can help. It's also important to be aware that certain substances can block iron absorption. Calcium supplements and dairy products like milk, cheese, and yogurt contain calcium that competes with iron for absorption. Tea and coffee contain compounds called tannins and polyphenols that bind to iron and prevent its absorption. If you're taking iron supplements or eating iron-rich foods, try to avoid consuming these items at the same time. Wait at least 2 hours between taking your iron supplement and drinking coffee or tea or eating dairy products. If you enjoy these beverages, consider drinking them between meals rather than with meals. One interesting tip that some people find helpful is cooking with cast iron cookware, especially for acidic foods. Small amounts of iron leach from the pan into your food during cooking. When you cook tomato sauce, the chili con or other acidic foods in a cast iron skillet, the acid helps more iron transfer from the pan to your food. Over time, this can contribute small but meaningful amounts of iron to your diet. Make sure you're getting enough vitamin C in your diet overall, as this vitamin is crucial for iron absorption. Good sources include citrus fruits like oranges, grapefruits, and tangerines, as well as strawberries, kiwi, bell peppers, broccoli, Brussels sprouts, and tomatoes. While iron supplementation can be very beneficial for people with iron deficiency, there are some important cautions to keep in mind. Iron supplements can cause digestive side effects in some people, including constipation, nausea, stomach pain, dark-colored stools and/or diarrhea. These side effects are quite common and affect many people who take iron supplements. If you experience these side effects, talk to your doctor about adjusting the dose or trying a different form of iron. Some forms, like ferrous bisglycinate or iron polysaccharide complex, tend to be gentler on the stomach. Taking your iron supplement with a small amount of food can also help reduce stomach upset, though this may slightly decrease absorption. It's very important to store iron supplements safely and keep them away from children. Iron overdose can be extremely dangerous for young children, even from what seems like a small amount. Always keep supplements in a secure location that children cannot reach. Take iron supplements only as directed by your healthcare provider, and don't take more than recommended thinking it will work faster. Too much iron can be harmful and can actually cause serious problems including liver damage, heart problems, and increased risk of certain infections. People with certain medical conditions need to be particularly careful with iron supplementation. If you have a condition called hemochromatosis, which causes your body to absorb too much iron from food, you should absolutely not take iron supplements. People with frequent blood transfusions, certain types of anemia that aren't caused by iron deficiency, such as thalassemia or sickle cell disease, or active infections, should also discuss iron supplementation very carefully with their doctor. If you have any chronic health conditions, always check with your doctor before starting iron supplements. It's essential to never start iron supplements without first confirming through blood tests that you actually have iron deficiency. Taking iron when you don't need it can lead to iron overload, which is a separate health problem that can cause organ damage over time. The body has no efficient way to get rid of excess iron, so it can build up in organs like the liver, heart, and pancreas. Also, it's important to understand that iron supplements can interact with several medications. They can reduce the absorption of certain antibiotics, thyroid medications like levothyroxine, and medications for Parkinson's disease. If you take any regular medications, check with your doctor or pharmacist about the best timing for taking iron supplements to avoid these interactions. Finally, and this is very important, remember that iron deficiency is often a symptom of an underlying condition that needs to be identified and treated. Simply taking iron supplements without investigating the cause might mask an important health problem that needs attention. This is particularly important when it comes to digestive tract bleeding, which can be a sign of serious conditions. Your doctor needs to find out why you're losing iron so the root problem can be addressed. This information is educational and should not replace professional medical advice. Always consult with your healthcare provider before making changes to your diet or starting supplements. If you found this helpful, please give this video a like and share it with friends or family who might benefit. Leave a comment sharing your thoughts. We have 2 more videos on screen that you might find interesting. Thanks so much for watching, and take good care of yourself.